Hi, I'm Fausto Pinto, the president of the European Society of Cardiology, and I'm here in San Diego for the meeting of the American College of Cardiology. It's been a very nice meeting. It's been also very good to be with our friends from the ACC. We had a wonderful opening ceremony where the president, my good friend Pedro had a wonderful speech looking into the future of cardiovascular medicine, the future of the profession, with opportunities, with challenges, and that was very exciting. Then we had some of the late-breaking clinical trials. I was actually panelist in one of in the inaugural one, where two trials were presented. The PROMISE trial, which is actually a very important trial because it's one of the first ones that shows hard data on the use of imaging in assessing patients with coronary heart disease. And in this case was compared to strategies and anatomical assessment of coronary disease by using CT angio and a functional strategy by using a functional test. They were compared in about 10,000 patients. Dr. Pam Douglas was the presenter of this trial, which showed that follow-up that there was no significant difference between the two, but it opens the way for probably an increased use of CT angio, particularly in some subgroups of patients where it can really be useful for the assessment of patients with chest pain. The second trial was the PEGASUS trial on the use of ticagrelor in patients with coronary disease with more than 1 year after acute myocardial infarction, and in the long term, the patients who were on the ticagrelor, they had a better outcome when compared with the patients who were on placebo plus aspirin. And so the combination of dual antiplatelet treatment seems to be very important in this patient population. So these are just an example of two of the main trials that were presented here at the ACC. There are many other presentations. There have been a few others on imaging as well. There was the Scott Hart trial, which also looked at the use of CT angio in patients with chest pain, and again showing that for some subgroups of patients it might be very useful the use of imaging to rule out significant coronary disease and maybe select the ones that really need to go into cardiac catheterization. So it's really been a pleasure to be here in San Diego. We have a strong European delegation in this meeting, and we certainly hope to continue to cooperate with our friends from the American College of Cardiology, and certainly we hope to welcome you in London, where we will have our Congress in the end of August, and where we hope to have a very strong group of colleagues. We just had the abstract deadline with over 11,000 abstracts, so we're very much hoping to have again a very good meeting with the cardiovascular community from the world. So see you back in Europe. Bye-bye.